Hello everyone, this is Kerry Anderson. Hope you all doing well. In today's video, I'll be talking about building muscle helps reverse diabetes. So if you like the video related to my health, my way, I would like to request you all please do subscribe the channel, hit the bell icon and give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. Building muscle helps reverse diabetes. The key to exercising your way free of type 2 diabetes is to become healthily muscle bound by doing weight training, says exercise psychologist Rob Newton. That's because muscle are the greatest sink well of blood glucose in the body, so the more muscle tissues you have, the less extraneous glucose will be circulating, wreaking damage on blood vessel organs and tissues. This also guards against insulin resistance, where the body's insulin becomes less efficient at controlling blood glucose level. Muscle tissue during exercise is the greatest absorber of glucose in the body, said Professor Newton from Edith Cowan University School of Exercise and Health Science. Even at rest, muscle tissue scavenges glucose out of the blood, helping the body maintain healthy blood glucose level and preventing insulin resistance. Professor Newton said research showed that even a single session of resistance or aerobic training reduced blood glucose level for the following 24 hours in people with impaired glucose tolerance or type 2 diabetes. Regular weight training over 3 to 6 months can turn around type 2 diabetes and eliminate much of the insulin resistance and adverse effect. New research was indicating that increasing muscle mass might be more important than fat loss in controlling high blood glucose and insulin resistance. Weight loss strategies such as lap band surgery, dietary restriction, and appetite suppressing medication that resulted in a big food and kilojoule restriction also result in a loss of muscle and might compromise the goal of reversing type 2 diabetes. In such cases, without specific exercise to maintain muscle bulk, so the body lost both fat and muscle tissue, thereby lowering its relative proportion of muscle. There are very real concerns that weight loss programs, which all result in a loss of muscle tissue, may actually increase the risk of type 2 diabetes, particularly as fat is often regained but the muscle mass remain depleted. It has also been shown that the percentage of total body weight comprised by muscle is a predictor of insulin resistance and whole body inflammation, key factors in the development of other big lifestyle diseases such as heart disease and many cancer. Aerobic or endurance exercise was also important to help burn fat and lose fat to reduce the risk of heart attack or stroke in people with type 2 diabetes. If you have a moderate level of cardiorespiratory aerobic fitness, is protective against heart attack and stroke, and the effect is about 3 times greater than simply reducing body fat. However, it was important to combine this with specific resistance training to build and maintain muscle mass. Exercise advice. Exercise psychologist Matthew Harris said, while more than a stroll in the park was needed to be beneficial for type 2 diabetes, the exercise required did not need to be onerous. His key tips include: before starting an exercise program, have a medical check with your GB. See an accredited exercise psychologist to prepare a program to meet your specific health need. Invest in comfortable, well-fitted shoes. Exercise should include a combination of cardiovascular, aerobic, and resistance weight training. Untrained individuals should commence at a low to moderate intensity and gradually progress to a higher intensity. Aerobic activity should be performed for at least 30 minutes a day at a moderate intensity. If weight loss is desired, 60 minutes is recommended. 3 sessions of resistance training a week have been found to be beneficial for glucose metabolism, weight loss, strength, balance, and functional capabilities. Daily insulin traps can be the bane of existence for people who live with type 2 diabetes, but an investigational once weekly insulin shot may be a game changer for these folks. While the research is still in its early stages, the new drug called basal insulin is given once a week and appears to be just as effective at controlling blood sugar as insulin degludec, the gold standard once a day shot. The once a week shot is as safe as insulin degludec and may be better at reducing risk for dangerous low blood sugar throughout the day and night. The new study showed the major benefit of once weekly insulin is that more people will be willing to comply with the treatment. So, better compliance prevent complication of diabetes, including heart disease, vision loss, and kidney problems. It is 52 injections a year instead of 365 to 700 plus. Who was not involved with the new study on the 100th year anniversary of the discovery of insulin? It's amazing to see continued innovation in insulin therapy. Both insulin, degludec, and BIF are forms of basal or background. Long-lasting insulin, they control blood sugar level between meals and are released 24 hours a day. Some type of basal insulin are given twice daily. By contrast, bolus insulin is given after meals and at other times when blood sugar rises. Once weekly insulin shot would not negate the need to monitor blood sugar level and take more insulin as needed. The 32-week study included nearly 400 people with type 2 diabetes, a form of the disease most closely related to obesity. Participants were assigned to one of three treatments groups: once weekly injection of BIF at one of two doses or one daily injections of insulin degludec. Blood sugar control was similar for folks who received a weekly shot and those who took daily shots as measured by hemoglobin A1C. This provides a snapshot of blood sugar over the past 2 or 3 months. Additionally, weekly shot resulted in significantly lower rates of hypoglycemia. Day-to-day insulin concentration are steadier with a once a week shot, and that improvement likely leads to less hypoglycemia. So that's all about the diabetes in this video. I hope you all liked it. So before signing off, I would like to request you all, please do like, share, subscribe this video with the loved ones so that they will get to know better. So this is Carrie Anderson signing off. We will definitely come with the next video with my another content. Till then, God bless you. Bye bye and take care.